Hello, I'm Dr. Jonathan Irlew, Indian Health Service, Chief Clinical Consultant for Infectious Diseases. I would like to go over some of the facts on the use of BAMLANIVIMAB for the treatment of early mild COVID-19 disease. Hello, what is BAMLANIVIMAB? BAMLANIVIMAB is a neutralizing antibody drug. When there's a virus in the body like SARS-CoV-2, the causative agent for COVID-19 disease, the immune system makes antibodies to fight it off. But this takes time. It takes time for the body to make antibodies for a new virus. In the meantime, patients could get very sick. The drug BAMLANIVIMAB contains man-made antibodies that are similar to antibodies the patients who recovered from COVID-19 disease. Scientists think these antibodies might help limit the amount of virus in the body. This could give the body more time to learn how to make its own antibodies. This product does not contain any SARS-CoV-2 virus in it. In a clinical trial, scientists found that BAMLANIVIMAB may limit the amount of virus in the body for people with COVID-19 who take the drug within 10 days of the onset of symptoms. They may also be less likely to need to go back to the emergency room or to be admitted to the hospital. Authorized use. The FDA has issued an emergency use authorization, also known as an EUA, to permit the emergency use of the unapproved product BAMLANIVIMAB for the treatment of mild to moderate COVID-19 in adults and pediatric patients. These are patients who have a positive SARS-CoV-2 viral test, who are 12 years of age and older and who weigh at least 40 kilograms, who are at high risk for progressing to severe COVID-19 and/or hospitalization. So to be clear, this is not a FDA-approved drug. This is a drug being released under emergency use authorization because it may have some benefit to help patients with COVID-19. Who is this drug for? BAMLANIVIMAB is a treatment option for people with COVID-19 who are age 12 or older, weigh 40 kilograms or more, have mild to moderate symptoms for 10 days or less, and are at high risk to get very sick from COVID-19. This drug is not for people who are already in the hospital because of COVID-19 symptoms. The drug could be harmful to those people. The drug is for adults who are age 65 or older, have obesity with a BMI of 35 or higher, have underlying conditions such as diabetes, chronic kidney disease, or a condition that weakens the immune system, take medication that weakens the immune system, or are age 55 or older and have heart disease, high blood pressure, or long-term lung disease. The drug is indicated for pediatric patients aged 12 to 17 if they have obesity with a BMI higher than 85% of patients of the same age or gender, have heart disease, sickle cell disease, asthma, or another long-term lung disease, have a developmental condition like cerebral palsy, or who regularly use medical technologies such as a ventilator or feeding tube. Who is this drug for? What are the limitations on the authorized use of this drug? So the FDA has made it really clear that BAMLANIVIMAB is not authorized for use in certain patients. So number one, patients who are hospitalized due to COVID-19 should not receive BAMLANIVIMAB. Patients who require oxygen therapy because of COVID-19 should not use BAMLANIVIMAB. Patients who require an increase in baseline oxygen flow rate due to COVID-19 and those who have chronic oxygen therapy due to an underlying non-COVID-19 related comorbidity. For instance, if somebody had COPD, they're on 2 liters when they start, but because of COVID-19, they're now on 4 to 6 liters. that person should not get bamlanivimab. The drug could actually be harmful for people in this category. What are the limits? Dosage and administration overview. BAMLANIVIMAB injection contains 700 milligrams per 20 ml of fluid. The drug is available as a concentrated solution that must be diluted prior to administration. The dose of bamlanivimab in adults and pediatric patients 12 years of age and older, weighing at least 40 kilograms, is a single intravenous infusion of 700 milligrams of the drug administered over at least 60 minutes. It should be administered as soon as possible after positive viral test for SARS-CoV-2 and within 10 days of symptom onset. Dosage and administration. Recommended dilution and administration instructions for bamlanivimab. The drug bamlanivimab comes in a vial containing 700 milligrams. This is ordinarily prepared by a pharmacist to go into a 200 ml infusion. The infusion rate is 200 ml per hour, and the minimum infusion time is 60 minutes. So you basically want to run this 200 ml of diluted solution in over 1 hour. Of note regarding the administration, the authorized dosage, as we've mentioned, is 700 milligrams administered as soon as possible after the positive test for the SARS-CoV-2 virus within 10 days of symptom onset. It comes as a concentrated solution that must be diluted. What's really important is that you run the drug bamlanivimab over 60 minutes through a pump or gravity using an inline PES filter. So you need to ask for a special filter to filter this medication as it runs in. After the 1 hour infusion is completed, it's required by the FDA that we observe patients for at least 1 hour after the infusion is complete to make sure that there are no side effects. It's also very important to remember that once a person is treated with bamlanivimab and are released to go home, they still need to self-isolate. They still need to use infection control measures like wearing a mask, isolating themselves at home, social distancing, avoiding personal items, cleaning and disinfecting high-touch surfaces, and frequent hand washing, just according to CDC guidelines. So once they're treated, they're not automatically cured. They still need to go through the isolation process and follow all the guidelines. How about the side effects? Hypersensitivity, including anaphylaxis and infusion-related reactions, are possible with bamlanivimab infusions. Patients need to be made aware of this. There is the potential for serious hypersensitivity reaction, including anaphylaxis, with the administration of this drug. If signs and symptoms occur, the drug must be stopped immediately, and appropriate medications and appropriate supportive therapy should be initiated immediately for an allergic reaction. Infusion-related reactions have been observed with the administration of this drug, so providers and nurses giving the drug need to be careful. The signs and symptoms might include fever, chills, nausea, headache, bronchospasm, hypotension, or angioedema. Also possible, throat irritation, rash, including urticaria, pruritus or itching, myalgia, or dizziness. If an infusion-related reaction occurs, consider slowing or stopping the infusion completely and administer appropriate medications and supportive care for an allergic reaction. In conclusion, BAMLANIVIMAB is a monoclonal antibody that has been given emergency use authorization by the FDA to prevent future emergency department visits and hospitalizations. It does not impact mortality. It is indicated for patients with COVID-19 with certain underlying conditions, as outlined earlier. BAMLANIVIMAB is not indicated for inpatients or for patients requiring oxygen due to COVID-19 or who require more oxygen than their baseline therapy secondary to COVID-19. Use of an inline PES filter is required for administration. Monitoring the patient during the 1 hour infusion and for 1 hour after is critical to look for signs and symptoms of hypersensitivity reaction. Patients treated with this drug still need to maintain isolation and COVID-19 precautions as outlined by the CDC. Thank you for your attention and wish you good luck in giving this medication to help protect your patients and keep them from requiring hospitalizations in the future. In conclusion,